Hi, my name is Maya, and the disorder I'm going to be focusing on is schizophrenia and other psychotic disorders. So the evidence-based intervention that I'm going to be talking about today is taken from an article entitled A Randomized Controlled Trial of Group Cognitive Behavioral Therapy versus Enhanced Supportive Therapy for Auditory Hallucinations, and that was in the Schizophrenia Research Journal. And the client I'm going to be talking about, her name is Miss Rachel Hamilton. She's 59 years old, African American, and she came into the DMH clinic where I work with the following presenting symptoms. She was feeling depressed, she wasn't able to sleep, she hasn't been eating well, trying to force herself to eat, she was crying constantly, feeling unmotivated to participate in social activities, and she was feeling overwhelmed, very nervous, and it was hard for her to leave the house. So the client reports that she's also been hearing voices, specifically the voices of her stepfather and her son. These symptoms have been persisting for at least 9 years, but for the past 4 or 5 months they became very intense for her. And she doesn't use any substances, and she's never been treated before in any kind of outpatient or mental health facility. So a brief history on Mrs. Hamilton. She has 7 step-siblings, and she grew up with them. They teased her constantly, they called her all kinds of names, they called her white, and they would say things like, "You're not my sister," because she had lighter skin than them. Her stepfather was an alcoholic man who she described as mean and hateful, and he would physically assault her mother. He also began to molest her when she was 8 years old, and he would be very verbally and physically abusive to her also. He threatened to kill her and her mother if she ever told anybody about the abuse, so she never did. Mrs. Hamilton was married for 15 years when she found out that her husband was having an affair with her best friend, and so she finds it hard to trust men or women. She has 2 kids. One is 40, a 40-year-old daughter and a 23-year-old son. Her daughter moved to Arkansas, and she hasn't talked to her in 2 years, and her son recently got a 25-year sentence in prison. So that was 4 months ago when he was sentenced, and that's when her symptoms got really bad. So the intervention I'm going to be talking about is taken from an empirical study, a randomized controlled trial comparing CBT to enhanced supportive therapy. The participants in the study were diagnosed with schizophrenia or schizoaffective disorder. They were between the ages of 18 and 65, and they had current persistent auditory hallucinations. So I chose to use the supportive therapy intervention because the results of the study were that clients who were assigned to supportive therapy actually perceived at 12 months after the treatment, they perceived their auditory hallucinations as less malevolent. So they used the Beliefs About Voices questionnaire, and they perceived their voices as less evil. And the client I was working with, she was kind of going through a process where she would feel terrorized by her voices, and so she was struggling with this issue the most. So that's why I chose to use enhanced supportive therapy to help her. So basically, this intervention is manual based. The manual is called Supportive Interpersonal Therapy for Schizophrenia. It's divided into 3 phases. I'll tell you more about that. It's 12 weeks long, 1 session a week for an hour. It's based, it aims to provide emotional support and counseling of non-symptom related problems. And the primary goal is to improve social integration by providing a supportive environment and by helping the client feel more satisfied with their level of social functioning and integration. So the 3 phases of supportive therapy are establishing a therapeutic alliance, agreeing on interpersonal goals for each member, focusing on social integration, and identifying steps to achieve those interpersonal goals. So the format is the facilitator will provide direct advice for client questions and problems. At the beginning they'll do a brief check-in, then they'll review the homework that they assigned. Then they'll discuss the interpersonal goals that they aim to reach and the progress or the obstacles that they've come across so far. So, step by step, if you wanted to do this intervention, you would start off by asking, is there anything about your social life that you'd like to improve? And maybe the client had a close friend that they kind of lost touch with over the course of their illness. and you would ask them, you would try and get them to set or identify a goal that they'd like to reach. And let's say they say, I want to spend one day with my friend just hanging out like we used to. That's my ultimate goal. You would help the client identify steps to reach that goal. So you would ask them, what can you do this week to sort of take a step towards that goal? It could be writing a letter to the friend. It could be looking for their phone number or asking a friend, hey, do you still have this phone number? They could even call them or practice like leaving a message or practice apologizing if that's what it takes to restart the friendship. And the theory that this article used to support supportive therapy was social rank theory. They said because supportive therapy focused on increased social integration and increased client satisfaction with their social engagement, it may have helped increase their self-efficacy and their social potency. And that's part of social rank theory, basically saying they generalized the self-efficacy to the relationship with the voices that they heard, so the voices were perceived as less malevolent. So the groups that might not best be treated by this type of intervention would be groups that aren't necessarily experiencing persistent auditory hallucinations. It may be someone who's depressed with psychotic features, but it's not, they might benefit more from CBT for depression. And the countertransference reactions that I might have as a clinician working with this population using this intervention, I might have some feelings of doubt and fear or something working with these clients. Maybe they're feeling a little uncertain about engaging with people that they lost contact with or people that they offended, and they want to really reach out to their friends, and maybe I'm feeling uncertain or some doubt or some fear because of the countertransference. And so, social work values that apply to this intervention. Basically, this intervention demonstrates it really enables the client to feel empowered and to set her own goals and to help her identify the steps that she can take to achieve those goals. It also enables the client to sort of determine what changes she's going to make, she's going to plan to make, and what changes she's actually going to be able to go through with to improve her social life and interpersonal functioning. So supportive therapy is the intervention I would choose for clients with schizophrenia. Thank you.